Welcome to today's webinar on ACL tears. We're going to be talking about your risk and what you can do to prevent these tears. My name is Michelle Botsford. I am a physical therapist practicing at an outpatient clinic in Portland, Oregon. A quick little bit about me: I earned my doctorate in physical therapy from the Northern Arizona University in 2018. Previously, I'd gone to the same university and gotten my Bachelor of Science in Exercise Science. I'm also a certified strength and conditioning specialist through the NSCA, and I'm working at Bridgetown Physical Therapy. Again, that's in Portland, Oregon. And I have a special clinical interest in outpatient orthopedics, specifically knee injuries and return to sport rehab. So getting right into it, our objectives for today's webinar are that at the conclusion of this webinar, you will be able to have a basic understanding of the anatomy of the knee, understand how exactly ACL injuries happen, recognize risk factors for ACL tears, and understand what components are necessary to include in creating a prevention program. We'll start off looking at some ACL tear stats. There are between 100,000 and 200,000 tears every year in the United States alone. This is the most commonly injured ligament of the knee, and about $500 million of healthcare costs go toward treating these tears in just the US. 70% of these injuries are non-contact, and we'll get more into the specifics of what that means later on, and most of these tears are complete tears. The incidence of these tears in teens, according to the American Academy of Pediatrics, has increased by 147% over the last 10 years, and each year that is increasing by 2.3% in 14 to 18-year-olds. So it's really important that we start now looking at ways that we can prevent this, because it is a very serious injury and has a huge impact on the athlete's career moving forward. Next, we'll look at the anatomy of the knee, and we will keep it fairly basic for today, just pointing out major structures that are important to keep in mind moving forward throughout the rest of this presentation. Starting with the big bones that make up the knee joint here, we've got your femur, your big thigh bone, moving down to the tibia, and your fibula here off to the side, and then also you have your patella or your kneecap. Muscle-wise, we've got the quadriceps that run along the front of your thigh. Hamstrings are on the opposite side. And we have two collateral ligaments, one here on the outside, your lateral collateral ligament, and then on the inside, your medial collateral ligament. And those are responsible for preventing any inward or outward caving at the knee. We've also got the main event, your anterior cruciate ligament, or your ACL, and your posterior cruciate ligament, your PCL. And those run in kind of an X position here in regards to each other. We also have your patellar ligament that connects your patella to your tibia, and moving up, we also have your quadriceps tendon that connects the kneecap into your big thigh muscles here. And last but not least, for the purposes of this presentation, we also have your menisci. So we've got a big one here on the inside called your medial meniscus, and out here on the outside, your lateral meniscus. They act as cushioning structures and help with stability at the knee, and are often also involved in ACL injuries. Next, we'll look at the role of the ACL itself and its responsibilities in controlling movement during athletic activities. It is responsible for preventing any excess forward movement of the tibia, so your big shin bone here. It also helps to prevent any medial or lateral rotation of that tibia relative to your femur. It also helps to prevent any caving in at the knee, which we'll refer to as knee valgus moving forward, as well as hyperextension of the knee. So the way these ACL injuries actually happen are most commonly through non-contact. So the player was not hit by another player. That's about 30% of the time that's the cause. But more commonly, we're looking at these non-contact injuries. So a plant and twist type of an injury, a poor landing, sudden stop, quick change in direction, or deceleration. This visual on the side is a great depiction of what these injuries look like in real life. So you'll see that basketball player was planting and quickly moving out of the way for the oncoming player trying to block that shot. But the foot gets planted, we see medial rotation of the femur, that thigh bone at the top, and an external rotation of the tibia, placing excess strain on that ACL and causing it to tear. So one of the big things we are discussing today is who is at an increased risk. It's very important to understand risk factors involved in these injuries so that we can control whatever we can. Females are 2 to 8 times more likely to sustain an ACL tear. A couple reasons for this are the quad to hamstring ratio for one. Females tend to be stronger in their quads when compared to the hamstrings. The hamstrings actually play a very similar role to the ACL in preventing that anterior translation of the tibia. So a decrease in hamstring strength is going to just place more load on the ACL. We actually see an increase in ligament laxity as a whole as well, so that ACL will be more lax. The wider hips that females have place us at a greater risk of ACL tears due to the angle made between our hips and our knee called your Q angle. And the ACL itself is also smaller in females when compared to our male counterparts. The sport that you play will also play a huge role in your risk of ACL tears. So if you are a soccer player, football player, gymnast, basketball player, and have a sport that requires a lot of stopping and starting, cutting, jumping, you will be at an increased risk of tearing your ACL. Poor body mechanics, poor conditioning, if you're not well prepared to perform these kind of movements, you'll be at an increased risk, as well as improper equipment. So shoes, we all remember the Zion Williamson Nike shoe just blowing out. Things like that can put you at a huge increased risk of tear as well, in addition to playing on artificial surfaces. So your risk of tearing your ACL when playing on turf, especially in football players, studies have found that can be a risk factor. So let's look at what an ACL injury actually looks like if you are unlucky enough to sustain one of these. So at the time of injury, most athletes will report that they did hear an audible pop, followed by pain and swelling quickly after. There's also notable difficulty in putting weight through that affected limb. So once an ACL tear has been suspected, then whatever athletic trainer, sports physical therapist is present will do some tests to determine if an ACL tear is likely. If so, athletes will go through an MRI just to confirm the tear and the severity and any other soft tissue damage that may be involved. Then the athlete has the decision to make if they're going to move forward with a surgical intervention or conservative management. Conservative management looks at bracing, strength training, regaining range of motion, everything that you would be doing after surgery. You are just committing to moving forward without the presence of an ACL. At least in the short term, you can begin with conservative management and move on to surgical intervention later on, just depending on where you're at with your goals, career, life in general, something to keep in mind. But the overall rehab process will look fairly similar. Again, understanding if you've gone through surgical intervention that you will have a new ACL actually put in surgically. So that does come with a lot of additional complications when going through the rehab process. But just a general overview, we're looking at regaining range of motion, strength, endurance, neuro re-education, preventing re-injury, and if applicable, if you're trying to return to sport, then we're working on sport-specific training as well. So looking at the surgical side of intervention following these ACL tears, this is necessary if patients are noticing a continued laxity with conservative management, bracing isn't doing quite enough, or you're just not able to get back to your full level of sport or activities of daily living without having an ACL. So patients will go through an ACL reconstruction where they're actually having a new ACL created out of a graft taken from either your own body or a cadaver. So common grafts used are a patellar tendon graft, a hamstring tendon graft, a quadriceps tendon graft, or again, that cadaver graft taken from someone else. Looking forward at the full timeline for recovery, it can be anywhere from 9 months up to 2 years, and that is super relative depending on the patient, how they've been progressing, what their goals are. But for any patient that's planning on returning to sport, that 9-month mark is really important. Getting back to sport earlier than that has not been shown to be very advantageous and does put you at a greatly increased risk for tear. Each month that you delay return to sport up to those 9 months decreases your risk of re-injury by 51%. You are 7 times more likely to re-tear if you do return prior to that 9-month mark. And patients in general, when you're returning to sport, it is important to remember that you need to keep up with exercises, rehab, because you are more likely to re-tear in those first 2 years. So that's why the 9-month to 2 years timeline comes into play. It's just when you are at an increased risk up to those 2 years, but it significantly decreases if you wait until 9 months to return to sport. And again, it's super different from athlete to athlete, but a huge marker to keep in mind timeline-wise moving forward. Now that we've thoroughly discussed ACL tears, how they happen, who they happen to, let's move on to talking about how we can prevent them. So considerations for creating a successful prevention routine, first of all, starting it early in an athlete's career, as young as 12 years old is appropriate. The earlier you start, the better. The best results are seen in athletes that are under 18 years old, and that just primes them moving forward into a more competitive career later on. These routines should be performed starting in preseason and then be carried out throughout the regular season as well. And supervision to provide some external feedback should be provided. So coach, training staff, someone being there to cue athletes during their routine to make sure that exercises are done properly. Overall, this prevention routine should be performed about 2 to 3 times a week and to be 20 to 30 minutes long, and consistency is absolutely key here. So if you're not going to do the program consistently, we're not going to see the results. So making sure you keep with that 2 to 3 times a week consistency is the best way to set yourself up for success. And you want these routines to have plyometrics, strength, and agility as the 3 components. And we'll look a little bit closer into those next. First, we'll look at strength training, so keeping muscles strong and prepared to provide support to the knee joint, so an athlete is not completely dependent on ligaments and getting laxity throughout there that puts them at an increased risk of tearing. So hamstrings to start are the big one on the back of your thigh. They perform knee flexion and hip extension. And I had mentioned earlier on, they also perform a similar role to the ACL. So keeping them strong is absolutely essential. So hamstring curls, deadlifts, exercises of that nature are essential. Quads perform knee extension and to some degree hip flexion. So any kind of squats, knee extensions on a weighted machine are really important for just providing overall stability. Glutes are a huge component of knee stability as well. So they perform hip extension, abduction, internal and external rotation at the hip. And most importantly, they give you that valgus control. So we talked about the caving in at the knee, and your lateral glutes, that glute medius, is essential for preventing that dangerous positioning during landing, cutting, jumping. And we'll look at that more in the next slide as well. But sides of the hips are huge for preventing ACL tears. A lot of that band work is helpful, clamshells, lateral steps, side planks, everything. And the trunk as well. Just your core in general provides total stability from the top down. It's important to not neglect that and only focus on the legs. Another important part of strength training that we don't want to neglect is that it should be challenging for your athlete. We want to work on providing progressive overloading, whether that's through increasing the weights, the reps, the sets, or decreasing your rest. Strength training should provide a challenge. It shouldn't just be the same exercises over and over again with no change. We want muscles to constantly be growing, constantly having to adapt. So providing that kind of an overload to the patient. Next is plyometrics. So we're talking about any kind of a jumping and especially the landing component of this training. So in this picture, you can see on the side where the player's knees are caving in. So he's showing that dynamic knee valgus, the adduction at the hips. That is a position that places you at an increased risk for an ACL tear. So this kind of bowing in at the knees. like we had just talked about, side of the hips are what helps to control that. So keeping those strong, like we talked about in the previous slide, is very important. But also just watching and cueing during the landing to see that we're getting more of this preferred neutral knee when we land, not getting the caving in. So we're looking at the athlete performing their jumps with a soft landing, getting that appropriate force absorption through the slight bend in the knees, and controlling for that knee valgus. So some examples of drills, we got single leg hops, double leg hops, bounding hops, landing drills, box jumps. All of that is great as long as they're getting some kind of an external cueing to make sure that we're getting this versus this. That's the most important part. And lastly, another big major category is agility. So we're looking more at the athlete's ability to perform these quick cutting, pivoting, stop-start activities, and we'll often use cones, ladders, reactivity training drills with our patients. So we're looking at not only is the athlete able to perform these movements with speed and accuracy, but most importantly, we want to see that they're done with control and that the athlete is able to navigate in these dangerous positions. With sport, it's understandable that we can't control everything, keeping the knee in that perfectly safe, non-valgus position. There's just a lot going on, but seeing that they're able to, especially with these reactivity drills, be aware of where their body's positioned in space when there's other things going on, there's external variables as well, it's essential moving forward to actually seeing success on the field. So agility training is a huge one here, and providing athletes with a wide variety of agility training as well as variable factors that you can throw in as well. If you are an athlete that falls into any of those increased risk categories for sustaining an ACL tear, we're trying to do as much as we possibly can as physical therapists to prevent these injuries. I prefer to not see you in my clinic, though I do love working with ACL tears. So getting an assessment by a physical therapist is another great way to significantly reduce your risk. I do screenings at Bridgetown Physical Therapy here in Portland, where I am able to take a patient through a thorough screening to check for any imbalances, weaknesses, faulty movement mechanics, or training limitations. And then we take that information and move forward with a routine to help correct those dysfunctions so that we can reduce your risk. Because again, I love working with these young athletes that have gone through these significant injuries, but I'd much prefer that you just didn't have them in the first place. And of course, if you have any questions at all regarding ACL tears, prevention, or what we're doing here at Bridgetown Physical Therapy to do our part in preventing these major injuries, feel free to send me an email. It's listed there, Botsford@bridgetownpt.com. I'd be happy to hear from you. And thank you so much for everyone that tuned into this webinar. If you are interested at all in some of my resources, great articles that I've been using and looking at to determine success with prevention programs and return to sport training in general, I've listed them here. Got this one slide and this next slide, so feel free to take a screenshot and do some research on your own as well.